Welcome, Rehabpreneurs. This is the Rehab Roundup. I'm your host, Dr. Hassan, broadcasting from Phoenix, Arizona. It is hot. I think last week it was 111. This week it's a little cooler, 103. But yeah, it is hot. It is definitely hot. Last week we talked about marketing during a pandemic. Dr. Kadisha, thank you for joining in. So when we talked about marketing during the pandemic, we talked about 4 specific kind of sites and focuses. ER observation was 1, home health companies was 2, surgery centers was 3, and number 4 was kind of directly to physician offices. So if you missed that, that's definitely on the page. You can go back, take a look at that. And for those of you all who attended or had a chance to watch, I really hope that was helpful because we are in a pandemic and things have really changed in terms of where the patients are, where the audience is, and where we have to go to get them. So check that out. Hopefully you pick up some good tips from that. Today's topic, we're going to talk about partnering with prosthetics and orthotics. I think that's a great opportunity to really kind of focus in on a couple different patient populations to really educate and really drive outcomes and get those patients to the right level of care. So that's going to be important as well. Let's see. We talked about that. Oh, please share this broadcast with any other physiatrists or anybody else who you feel may benefit from this information. And also tag a physiatrist or someone else you feel would benefit from this information because it's going to be some good information. I try to give really good information, high yield, every Tuesday during the Rehab Roundup. And really, kind of focused around the business of rehab. This is stuff they don't teach you in residency and stuff that will help you build and grow your practice. So let's see, we got some folks coming on. I appreciate that. I'll wait a little bit longer, maybe a minute, 30 seconds, and then we'll kind of get into the show. Hopefully you guys had a good day today and you're kind of winding down. For me, it's getting toward the end of the day, so I'm excited about that. And yes, hard at work as always. Yes, thank you, Dr. Khadijah. I'm sure you're working hard as well. So I appreciate that acknowledgement. I think we're going to get started. Yeah, I know Nick Cordero just passed away of COVID-19. So for anybody out there who does not think this is real, it is real. And I know in my experience here in Arizona, the cases are skyrocketing. They are going through the roof and patients are getting sick and needing to go to the hospital. These patients are ending up on ventilators. And if you think about it, average length of stay, from what I'm hearing, is anywhere from like 2 weeks to a month for these COVID patients. And once they're finished, they're going to need some type of therapy. And a lot of times they're going to need acute inpatient rehab. So we're going to see these patients at my facility in, anywhere from 2 to 4 weeks. So just got to ramp up, stay safe. Take proper protocol, PPE, and then help them get better, because this is a life-altering experience, and it's not the end of the road, especially if they do pull through. So they're going to need rehab to kind of get them back to life. So welcome to the Rehab Roundup. I am your host, Dr. Hassan, board-certified physiatrist and independent practice owner. I help physiatrists start and grow their own independent practice so that they can achieve financial independence and live without limits. Like we talked about, today's topic is partnering with prosthetics and orthotics. So when we talk about prosthetics and orthotics, 2 of the big patient populations that come to my mind are stroke patients as well as amputee patients. So on the orthotic side, that's really dealing with the stroke patients and a little known complication, foot drop in those patients who have weakness on that paretic side And then on the prosthetic side, you have your amputee population. So below the knee amputation or above the knee amputation. And a lot of times for these patients to get back to ambulatory community, they're going to benefit from a prosthesis to really help them reintegrate. So when we're talking about stroke patients, like I said before, they develop a condition called foot drop. So basically that's a big fancy word for inability to dorsiflex or lift up the toe and ankle. What that does is if you're not able to effectively lift up your toe and ankle, that causes the toe to drag. If that toe drags, that puts the patient at an increased risk for tripping or falling. As a result of that, patients psychologically develop a fear of falling. Because if you think about it, if you're afraid that your toe is going to catch and you're going to fall when you're walking, that really plays with your psyche, and you develop this fear of falling. And that subsequent fear of falling will lead to the patient not wanting to ambulate. If that patient doesn't ambulate, that's going to put them at increased risk for developing blood clots, and those blood clots can kind of break off and go to the lungs. So it's really important to make sure that our stroke patients remain ambulatory so that they don't have any further complications from that initial stroke. One of the big things that the orthotist or orthotics individual can do is get you something called ankle foot orthoses. Basically, it's a really cool brace that kind of stops at about mid-calf, and it goes up underneath the foot. And what it does is it helps to keep the foot in a neutral position, so a 90-degree angle where the foot is kind of at a 90-degree to the lower leg. And as a result, that helps that foot clear when the patient is walking or ambulating. So that eliminates that toe drag, and as a result, the patient has more of a normal gait pattern, and they don't develop that fear of falling because now they don't feel like the toe is going to drag and that they're at an increased risk for falling. And that's going to be huge because, like we talked about before, now this patient is going to remain ambulatory and not be at risk for developing blood clots and subsequently the clots going to the lungs. And your orthotics individual can help you. So what I do a lot now is when a patient is with me in acute inpatient rehab, Dr. Cassandra, thank you for joining in. When a patient is with me in rehab, what I like to do is have the therapist use an off-the-shelf brace and basically have that patient ambulate. And you can kind of see it immediately. Their face kind of changes, and they have this level of confidence when they're walking because they're not afraid that that toe is going to drag when they're walking. I know sometimes the therapists say, oh, I don't want to put them in a brace because, it'll impair their ability to regain strength. That's not true. What you can do is trim that brace down as they start to get stronger. I think one of the benefits of doing my residency at Marion Joy was my program director, Dr. Rao. He had us in an orthotics clinic every single week. At the time, a lot of residents, it wasn't our favorite. But looking back on it now, I really appreciate it because now it's provided me with the knowledge to do what's in the best interest of my patient and get them back ambulatory and really help them, like I said, decrease that fear of falling, decrease that toe drag, and keep them ambulatory and back in the community. So that orthotist or orthotics individual is going to be very beneficial in terms of helping you. So another patient population that is really underserved, maybe different in your area, but I know here in Arizona is the amputee population. So we see a fair amount of below knee amputations and above knee amputations in the acute care hospitals. But what's happening out here is these individuals are being discharged to a skilled nursing facility or home. And evidence-based medicine shows that when patients are discharged to an acute rehab facility, unit, hospital, it's kind of all the same thing, they have better outcomes, functional outcomes, and they are transitioned quicker to receiving a prosthesis and eventually, becoming ambulatory again, getting back into the community, getting a job, different things like that. So that's going to be huge to really service this patient population and get them to the right level of care, get them involved with a prosthetist so that they can really transition to getting that prosthetic to get more functional and more independent. So some of the big advantages to getting patients to acute inpatient rehab after they had a lower extremity amputation is the 3 hours of therapy. That's not 3 hours all at once. It's definitely broken down, but you get physical therapy, occupational therapy. They're treated by a rehab certified nurse. And that's going to be important because these nurses are trained specifically in rehab related issues to make sure that patients don't develop any complications as a result of this. Coach Leah, thank you for joining in. I appreciate it. So they're going to be treated by a rehab certified nurse. They're going to get access to neuropsychology. A lot of these patients, if you think about it, they are grieving. They have a loss of limb. They are depressed. So the neuropsychologist is really going to assess them, evaluate them, and provide them with coping mechanisms to deal with this life-altering event. So neuropsych is not available at home, and it's definitely not available at the subacute level of care. So that's why it's really important to get them to acute inpatient rehab to really wrap them tight, provide them with the services, but also what they're going to get is the therapy team is going to work on strengthening. Also, a big thing is work on avoiding contractures. So basically that's a big fancy way of describing the muscles tightening up. So if you think about it, if you have a below knee amputation, if that knee develops a contracture, they can't completely straighten out that knee, and as a result they may not be able to fit into a prosthesis and they may not be able to walk with a prosthesis. So one of the techniques that the therapy team and the rehab doctor teach the patient is to lie on their stomach, and once you do that, then you by default kind of straighten out that residual limb, and that's going to help prevent contractions. So that's something that's huge that they do and teach in the acute inpatient rehab level of care that they may not do. Patients may not think about that when they go home. And they definitely may not do that if they go to a skilled nursing facility. Another thing the team really works on is pre-prosthetic training. So basically they develop the relationship with the prosthetist and they walk them through the process of what it's going to look like to get that prosthetic limb. They're also going to work on developing a test socket. And then another big thing that we do in acute inpatient rehab is work on the residual limb and making sure that the volume is really controlled, because you're post-operatively, you're going to have a lot of swelling and different things like that. And that residual limb isn't going to take the shape that it finally needs to be to fit into that prosthesis. So we really work on that, keep an eye on that. We also keep an eye on the actual surgical wound to make sure that it's healing, because a lot of patients who subsequently have to have an amputation may have some type of vascular event, diabetes, poor circulation, which puts them at risk for wound complications. So making sure that you have really great oversight of how that wound is healing is going to be very big for that patient population as well. And all this is kind of important because let's see, we got a quick question. What does it look like to do virtual diagnosis or treatment as a result of COVID-19 and social distancing? Really, that's kind of doing telehealth or telephysiatry. We can kind of talk about that at another time during another live, but thank you for that question. So really, it's going to be important to develop these relationships with the orthotics and prosthetics individuals because they already have relationships with neurosurgery, right? Neurology, vascular surgery, and orthopedic surgery. And these are all the individuals who are going to take care of these patient populations that need these services like ankle foot orthoses and prostheses. So they can function as gatekeepers to basically introduce you to these providers so that you can really talk to them and have a platform to explain, evidence-based medicine, why coming to acute inpatient rehab after that acute hospitalization is going to benefit that patient, how they're going to have decreased mortality and morbidity after their surgery, how they're going to have reduced subsequent amputations coming to this level of care, how they're going to be cared for better medically and from a rehab standpoint, and how these patients actually have more frequent acquisition of prosthesis just by kind of being in that pipeline and going through the system. So it's really a great partnership because everybody's kind of in the business of doing what's in the patient's best interest, getting them back more functional, and leveraging those existing relationships to educate these specialists on transitioning to acute inpatient rehab is really going to be beneficial and a win-win for everybody. So that's why it's hugely important to partner with the orthotics and prosthetics companies in your local area to develop these relationships and really do some good for these specific patient populations. So one of the things I would suggest is No Hanger is a big player in the orthotics and prosthetic space. Kind of do a Google search in your area, look up an office that's nearby, just kind of go in, introduce yourself, and kind of say, hey, I treat patients who have had strokes and patients who have had amputations. I would love to partner with you and your vascular surgeons, orthopedic surgeons, neurosurgeons, and neurologists, and really helping to transition these patients to acute rehab, improve the outcomes, get them back functional, get them into their prosthesis, and get them back into the community. So that can be a quick and easy way to develop that relationship and really help out a specific patient population. So so again, partnering with prosthetics and orthotics is going to be huge. And Coach Leah, yes, I will definitely drop a heads up, most likely on social media. I try and promote the topic for the next week on social media. So be on the lookout for that. You can follow me on social media at Dr. Hassan Rehab on pretty much all platforms. So do that and just be on the lookout for that topic. Next week, we're going to talk about really how to market. A lot of this is marketing, but it's more than marketing, but really marketing to PT, OT, and speech schools. Because if you think about it, these are going to be the folks that you're going to be working with at the different levels of care. So we're going to talk about how to do that, how to effectively do that, and get some good results from that. For my physiatrists out there, I'm dropping the link to my scheduling platform for you guys to sign up for a free 15-minute strategy session so we can talk about all things business of rehab. I know recently I dropped something talking about we're leaving a lot of money on the table. So that's something that we can talk about and discuss as well, especially now during this pandemic. Things have really changed, so we really want to maximize what we can do and the income we can generate and not really leaving anything on the table because it's going to be important, right? Let's see. I think that's it for now or for tonight. This is a Rehab Roundup. I'm your host, Dr. Hassan, board-certified physiatrist and independent practice owner. I help physiatrists start and grow their own independent practice so that they can achieve financial independence and live without limits. Join me next Tuesday, 7 Pacific time for the Rehab Roundup, where we will be discussing how to market to the physical therapy, occupational therapy, and speech individuals who are still in training to kind of help out as you get out. I dropped a link to my scheduling platform in the comments, so look out for that. Thank you for tuning in, and I will see you next week.